Hello, everyone. Thanks again for having me here at the International Workshop on HIV and Transgender People. It's a pleasure to be here. Again, my name is Dahana Perry, and I'm going to be presenting to you today on gender-affirming care from the community perspective. Just a little bit about me. I've been working with trans-identified and non-binary patients from a care coordination perspective. So it's pretty broad in terms of the scope of work that I've done. So it was everything from helping people manage gender marker corrections to surgery preparation. So it's a pretty broad spectrum, and I'm happy to kind of bring this perspective to the talk today. In terms of the work, I started out at Fenway Health doing HIV research, specifically behavioral health perspective, and then also at Callan Lord for about 8 years. And that work was largely focused on surgery coordination, especially in the later years. And so those are going to be the two programs that I speak about the most today. Just really quickly, the agenda, I'm going to cover some things that we already know. I'm going to assume some things about you as an audience, and then we'll cover some of the urgent community needs, patient engagement perspectives, talking a little bit about, an integrated health model, and then just some notes about funding transgender health programming. So what do we already know? The good thing to do, right? That we use correct name and pronouns. I'm going to assume that you understand that gender identity is not the same thing as sexual orientation, although there might be some overlap in someone's identities, they're not the same thing, right? We might know that there are several informed consent models of care out there and available, and that's a move that we're moving towards in terms of the mainstreaming of transgender healthcare. We understand that there is intersectionality around people's identities, and that needs to be respected in these kinds of clinical environments. There's also an increased visibility and acceptance of trans and non-binary identities, which is leading to this growing interest in our care. Other things we already know, that there are high rates of violence and discrimination against trans and non-binary people, very high rates of HIV amongst trans women, very high rates of suicidal ideation and social isolation, stigma, and there's also care deserts. And so that's why we're here to kind of talk about how we can manage this in the practices. So one of the first things I kind of want to note is the exponential increase in trans and non-binary identities. This is really shifting how we're providing care because now things are becoming more mainstream. We have an increase in research, interest in research on the different perspectives and best practices over the last 10 years. And in terms of the types of programs that do exist, I really just, again, want to only speak from my own experience. And I worked at Fenway Health down in these little years down here between 2004, I believe, and 2009. I worked in the research department, but you can kind of see in terms of the development of the trans health program, how many people they were seeing at the time and how much larger it has grown over the years. And I received this information from a colleague over Dr. Sarah Breisner from a presentation that he gave earlier this year. But this mirrors the experience that I had at Callan Lord when I was there from 2013 through just this past year. You can see in this chart over here for people that were coming in for HIV visits, which are the orange, which is the orange line, it plateaus, right? But people coming in for trans-related visits, which is in blue, skyrockets. To me, this shows that the fight against HIV is working, and that the treatments that are being developed are also working. But it also means that the need around trans health was also being kind of ignored. So we are seeing an increased demand, and we need to be prepared for that. So what does this mean for your practice? we need to spend more time with our trans and non-binary patients. Trans people want more time with their providers. I think anyone can really kind of identify with that. But there are moments where we're going to need to do some more research and to locate resources, and that requires more time. So we want to make sure that we're allowing enough time to meet with our members and with our patients, especially for people who are planning for surgery. That requires a lot of planning. So patient education is essential. Knowledge of surgical procedures, risks and benefits, and care planning in particular for people seeking bottom surgery is going to be paramount. You want to come from a trauma-informed care kind of perspective as you're navigating this with your patients. And you want to be really familiar with community resources and other staff members who can provide kind of more holistic model of care for your patients. One of the other things I kind of wanted to bring up today is kind of framing what we're seeing as urgent community needs, because a lot of things are urgent for trans people at all times. So this is not to negate or to erase other things like insurance and things of that nature, but housing and employment is something that is a huge issue for patients or for people who are trans and non-binary. Insurances are covering more items than ever, but access to other basic needs like housing and employment are not available at the same pace. And I think that the medical community can play a really big role in bringing that more to the forefront. So, we want to make sure that that's one of the focuses, but also in terms of insurance coverage. It's expanding, but navigating the coverage for hormone therapy and surgery still remains difficult. So you really want to make sure that you have people on your care team who can navigate that aspect of care for anyone that you're seeing in your practice. Another item that I wanted to cover is really focusing on an integrated health model. This is actually essential, and we all kind of know that we're all siloed in the work that we do. But when it comes to coordinating healthcare for trans people, in particular for folks who are seeking surgery, you want to make sure that you have a more broad approach, that you're bringing in, resources from non-traditional locations. So for instance, informal networks are really key to providing excellent care for trans-identified people. So knowing the different online resources, people local to where you're practicing who are providing care or alternative types of resources for people in the community, and making sure that you have a strong network of mental health providers, especially people who are trans identified and who might be people of color. And if you don't already have a strong medical legal partnership, partnering with the local legal aid in your state would be, or in your location would be key. One of the things I talked about earlier is that we already know that there's a high prevalence of HIV within the transgender population. The burden of this is on trans women in terms of rates of infection, and Black trans women in particular. And this cannot be denied, and it still needs to remain a focus for the care that we need to receive as trans people. But one of the things that I want to point out is, one of the things I've noticed anyway, is how funding is kind of delineated in a public health setting for when it comes to trans health programming and healthcare access. So one of the things I'd like to propose is that we, increase our interest in opportunities to study trans men. This is an underserved community within HIV treatment and prevention that, really doesn't get included. You can see in this advertisement for Descovy, they state in this scene and also below that Descovy has not been studied in people who were assigned female at birth. So there's a growing community of trans men who are having sex with other men, and this would be, a good time to really step up our focus in that particular community. One of the other things that I noticed working in trans healthcare and trying to find funding for trans health program expansion is that a lot of the funding available is filtered through HIV funding, and that includes HIV prevention deliverables. The thing about this is that it can often require that we're only able to work with, let's say, people who are HIV positive. And what that does is that it excludes a whole other population, part of the trans and non-binary population that could really use some additional care. So one of the things I'd like to kind of propose, or at least point out, is that we kind of untether trans healthcare funding from HIV prevention deliverables. The funding can still come from the same point, but I think expanding the type of programming that we're able to provide for people who are trans and non-binary would be amazing. I think that's a step that we should move towards. And so that's what these are just some of the points that I wanted to bring forward to you all today, just from my perspective of working within this field for some time. Thank you so much for tuning in, and I will talk to you during the Q&A. Thank you.